Our story is you can just jump in, Doug, at any point. January 2012, we really launched. We launched with some volunteers around the hospital that Doug and David had. David was CEO of the hospital at the time. Now he's gone to Chief Strategy Officer. But some volunteers would help us just kind of create a space that was different from any other part of the hospital so that we could, and I didn't come from healthcare, so I didn't really have that background. And so we met with them. We did some training on design thinking, on another theory we use, Theory U. It's deep innovation, like the inner core of the soul of innovation.
Sure.
How innovators bring their actual centered self to innovation. And then we created the space, and then we thought it was going to start out slow, so that the 12 volunteers we had that helped us create what would be a different experience in here. And we did a lot of study too. We went to other innovation labs. There wasn't that many in 2010 when we started looking. And then we based everything in research. And when we started the first projects, the volunteers that we had helping us choose colors and chairs and things like that, we divided them in half, and they brought 6 projects in. So those 12, they brought 6 projects. And David and Doug both said, we're going to have to really market after this to kind of get people involved, but we never had to. And once those projects started running, people just came in. We've had a steady stream ever since. Doug has been very supportive.
So back to the beginnings of starting this, you know, as we look at what our vision as an organization is, we look at our strategic innovation agenda as a system, our 8-hospital system here in Orlando, and the changes coming in healthcare. We had the space and the freedom to do something around innovation, so our organization was open to it. And the idea was, so when we first started this, we didn't have an idea that this is what it would be.
Right.
What we really wanted to do was to create a place and a mechanism for people to be able to innovate, and not just articulate we want to be innovative and we know we need to be innovative, but to actually give our teams and people the tools to be able to do that. So we brought on Karen, who was then working on her PhD actually, and her thesis was that she was working on was on innovation. And we took frontline leaders in our organization and people from our director level of the organization really to come together and say, and we'll work with Karen on what is the best way to go about this. And she already had a good idea that design thinking is a great tool. The philosophy behind our lab being Theory U, we started growing and developing within that core of 12. And as we went through that early process, we realized that, and looking at sites across the country, we kind of picked what we liked best from all of them. But we wanted a space that, and so we ended up with a space that is open. And when you walk in here, you know you're not in a conference room. It's not business as usual.
Yeah, it's pretty interesting.
Because we wanted people to know that this is different. This is not. It's not the next flavor of the month, if you will. This is part of a cultural transformation that we're trying to create within this campus, the start in the campus that could then grow across our whole system.
Which is so important in the current landscape of healthcare and the whole transformation that's underway.
It is. And a lot of innovation labs, when you look at them, they're really not open. And so one of the things that was very important to us as we went down a journey of creating this is that what we ended up with when we were done creating the prototype, and I say prototype because we've been fine-tuning it over the last 2 years.
We just say this whole thing is a prototype.
But what we wanted was something that was open to the 6,000 employees on this campus, that any employee could bring a project to the lab as long as it connected to one of our 4 priorities in our business plan. And they had a power source from either their executive or their director. And that freed up the team to be able to bring it in. So you know, a nurse can bring a project into the lab, and they can be part of creating a collaborative team. And I think that has set us, you know, aside as being very different from what we've seen out there. But it's also created a tremendous amount of energy and passion within our team about bringing projects in here, and the ultimate result and what ends up being happening back in the units and the areas in the hospital where they work. You know, people help manage what they help create.
Oh, for sure. Yeah.
And so it really is exciting to see the passion and the energy that comes out when you provide the space.
Sure.
And one reason why we've been successful, I mean, we committed to following the journey, and the journey just keeps going. We are passionate about creating a safe space and a dynamic space for anybody to come in and create. But we can never forget, I believe, that what set this apart were just a couple of things. We embedded it in the hospital, we made it easy access, but Doug and David, the two top leaders, were behind it, and from the front they kept saying, we're behind this, we support you guys. And they made the decision that people that are on the clock, they could stay on the clock when they came in, and people who that are salaried workers, they could come in as part of their work.
Wow.
And we also, Doug was so generous, we said, let's create a whole experience here, and let's provide food. And Doug's been very generous in having allowing food to be here. And we like to think we've influenced the chefs here, because they said we really want food that's different. And so they came up and spent several afternoons with us, and they were always surprising us with food.
That's incredible.
People have complimented us, and thanks to Doug, about the menus here, but we really are very mindful about having menus that keep people energized, not a lot of carbs. And every time we bring in a new person on our team, we have to sort of orient them to this new kind of sort of eat for life.
It's pretty incredible.
Creating order around what to some may appear as chaos, but chaos is usually organized.
Yeah, it is.
Focused chaos. That's
focused. But really, we want a space that is very intentional. So whether it's the food, the space, or what we're really intentionally after is creating an environment of creativity where people can feel a sense of trust, and the barriers that might creep up that kind of stifle creativity or thinking about new ideas, that is kind of dispelled in the space.
Sure.
And
that's awesome.
It's small little things, and sometimes big things, but usually it's a lot of